Are you a new parent or a caregiver for a newborn? Do you know what to do in case of an emergency with your little one? Whether it's a fever, burn, choking, or diaper rash, it's important to be prepared and know the right steps to take. Hi there and welcome to Yardy Baby. If you are looking for a channel that features baby-related tips every day, then you're on the right track. Make sure to subscribe to stay up to date on all things baby care. Being a parent or caregiver for a newborn can be overwhelming, especially when it comes to emergency situations. That's why it's important to know some basic first aid techniques to help keep your baby safe and healthy. In this video, we'll be discussing the most important baby care first aid techniques that every parent or caregiver should know. 1. Fever. If your baby has a fever, it's important to monitor their temperature and keep them hydrated. A fever is a sign that your baby's body is fighting off an infection or illness. The normal body temperature for a baby is between 97 and 100.4 degrees Fahrenheit, but this can vary slightly depending on the time of day and the location of the thermometer. If your baby's temperature is above 100.4 degrees, they have a fever. To take your baby's temperature, you can use a digital thermometer or a rectal thermometer. If you are using a digital thermometer, you can take it orally, under the arm, or in the ear. If you are using a rectal thermometer, make sure to lubricate the tip with a small amount of petroleum jelly and gently insert it about an inch into your baby's rectum. Hold your baby still and keep the thermometer in place for about a minute. If your baby has a fever, it's important to keep them hydrated by offering them plenty of fluids. You can give them breast milk, formula, or water. You can also give them acetaminophen or ibuprofen if they are over 6 months old to help bring down their fever. Never give aspirin to a child under the age of 18. 2. Burns. If your baby has a burn, it's important to act quickly to minimize the damage to their skin. First, cool the burn by running cool water over it for at least 20 minutes. Do not use ice or butter on the burn. Ice can cause the blood vessels to constrict, which can slow down the healing process. Butter can trap heat in the burn, which can make it worse. Next, cover the burn with a sterile bandage or clean cloth. If the burn is larger than the size of a quarter or if it is on the face, hands, feet, or genitals, seek medical attention right away. If the burn is smaller and not on a sensitive area, you can treat it at home. Keep the burn clean and dry and apply a thin layer of antibiotic ointment to help prevent infection. Change the bandage daily and apply more ointment as needed. 3. Choking. If your baby is choking, it's important to act quickly to remove the object that is blocking their airway. If you can see the object, try to gently remove it with your fingers. If you can't see the object and the baby is still able to cry or make noise, let them cough it up on their own. If the baby is unable to cry or make noise, you will need to give them 5 back blows between the shoulder blades and then 5 chest thrusts while holding them face down on your forearm. If the object still isn't removed after the back blows and chest thrusts, call 911 and continue with the back blows and chest thrusts until help arrives. It's important to remember that you should only perform the back blows and chest thrusts if the baby is unable to cry or make noise. If the baby is able to cry or make noise, it means that their airway is partially blocked and they are able to breathe. In this case, you should let them cough up the object on their own. 4. Diaper rash. To prevent diaper rash, make sure to change your baby's diaper frequently and use a diaper cream with zinc oxide. Diaper rash is caused by irritation from wet or dirty diapers, and it can be uncomfortable for your baby. To prevent diaper rash, change your baby's diaper as soon as it becomes wet or dirty. Use a diaper cream with zinc oxide to create a barrier between your baby's skin and the diaper. If your baby does develop a diaper rash, keep the area clean and dry and apply a diaper cream with each diaper change. You can also let your baby go without a diaper for a little while to let the air circulate and help dry out the rash. If the diaper rash is severe or if it is not getting better after a few days of treatment, it's important to see a doctor. These are just a few of the most important baby care first aid techniques that every parent or caregiver should know. Remember, in an emergency, it's always best to call 911 or seek medical attention right away. By knowing these basic first aid techniques, you can help keep your baby safe and healthy. Thanks for watching. If you found this video helpful, make sure to give it a thumbs up and subscribe to our channel for more helpful baby tips.